Hi there, I'm Dr. Bob Marcus and welcome to DDS GP. Today I'm going to go through two cases and give the narratives that I might give to a patient chairside to help you with what to say and how to say it, and how the app can help drive the conversation and the conversation will help drive the app. I encourage you, if you have not done so, to watch the video called Why DDS GP. This talks about the background of DDSGP, what's in the shadows. And what it is that we're not using the app to be an explanation tool. Now, wait a minute, isn't that exactly what the app is? Well, no. The app is designed to foster the relationship between you and your patient, sitting shoulder to shoulder and using the iPad as a focal point. As soon as we take the focal point away and we start talking about the x-ray over there on the screen or that TV over there with a video on it that you should watch, we've taken away the relationship. And if I might go on a quick tangent here, people are longing for relationships these days. Ever since COVID, many people work from home all of the times, some of the time, and the human to human relationship component goes away. They try their best over a video conference, but it's not the same, is it? So we shouldn't simulate such a conference in our office. Instead, we want to go ahead and take advantage of the fact that the patient is there and have the conversation. In my office, one of the biggest no-nos is letting a patient go and saying, I'll call you with the treatment plan information. What are we going to tell them? Then we can only tell them facts about the treatment and facts about the cost. Instead, we want to have the relationship. So I'm going to go through two cases. Case one will be a patient who has periodontal disease, and her name is Mary. So from this point forward, I'm going to narrate the case as if I'm talking to Mary, and you'll see how, one, efficient and quick DDS GP makes it, and two, the narratives I'm using to foster that relationship and have that patient say yes. Here goes. So up on the screen, we have the periodontal module, and I'm going to start the conversation now. Hey, Mary, look, we were taking a look at the teeth and gums, and we did find something we need to talk about. Do you have a few minutes to chat? You do? Great. Here's the thing. I always love to tell my patients good news, but right now I have found something in the mouth that is not in a state of health. Can I get your permission to go over that with you? Thank you. So if we take a look at this screen here on the iPad, you'll see that this tooth pictured is one that's perfectly healthy. You can see this instrument that we're using, which is what your hygienist just used a few minutes ago when she was checking the gums and bone around the teeth. We check how far this instrument goes in before it meets resistance into the little collar around your tooth, just like a turtleneck collar. In your case, the probe could go down too far. Yours is more like this. Now, all of this brown area represents bacteria, germs. They're getting in there that you can't clean out using home techniques like toothbrushing or flossing. It's too far down in there. Okay. Now, the good news is yours has progressed as I'm showing you here. Take a look. If I move this, you can see some people have really bad periodontal disease that gets really hard to fix. In fact, once it's at this stage, you'll find that oftentimes teeth are loose or even need to be lost. Thankfully, you're not. You're back at this stage here. Does that make sense? Okay, so now I'm going to go ahead and switch over to the periodontal treatment module. And you're going to see what we're going to do is a twofold treatment. Number one, we're going to numb the area so you feel nothing, and we'll clean out all of that stuff under the gums, just like is pictured here. Then we're going to apply a medicine down inside the gums, and that's going to help kill the germs that are causing the problem in the first place. Bear in mind, Mary, it's us and you aligned against these germs. Does that make sense? Alrighty, so what did I do there? I tried very hard to bring Mary in as a partner in this treatment. We're going to partner together, us against the bacteria. I showed her what was wrong. I showed her the consequence of inaction. In other words, this gets worse if we don't intervene, and I showed her what we need to do. I actually did the localized chemotherapeutics in that one. Some offices like those and some don't. There is a module in there that does not include those if you wish to use that one. That's it on the periodontal disease one. I hope it helps. Now I'm going to move on to another one that's common in the office, a cracked tooth. You're going to hear my narratives are very similar, and I want to go over a couple tools I used so you can try them. One, letting somebody know there's a problem. Now, I usually stay very, very general here and say, hey, there's something going on. There's some stuff going on. There's an issue I noticed. There's an area that's unhealthy. I don't want to use a bunch of dental words because they don't get that, and that's just scary to them. Remember, most patients are afraid of you. So that was step one. Step two, I want to ask permission. I do this with every patient. I'll say something like, hey, I'd like to talk to you about this. Can I get your permission to say something you probably don't want to hear? Because I have had situations in the office where patients say, well, no, I got to go pick up my kids. I got to go take care of my elderly mother. And they're not ready. We don't want to beat them up with a consultation when they're not ready. They're not hearing it because they're thinking about where they need to go next. That patient, I'll say, well, let's get you back in the office. By the way, I'll rarely say we'll call you unless they live really far away. Say, let's make an appointment. You and I will sit down, no charge, and we'll talk about it then. Okay? So the permission conversation ends in a yes, and then I can go into the treatment. And what I can say is something like this for a cracked tooth. I'm back in narrative mode, talking to a patient. His name is Joe, and I'm going to show it on the iPad screen. Hey, Joe. When I was taking a look at your teeth, I did notice something in that upper right back one. It looks like it's unhealthy. Now, Joe, I love giving people good news, but right now, everything else looks fine, but that one, not fine. Are you okay to talk about that for a couple minutes? Thanks. Joe, as you look here on this screen, you'll see an example of a tooth that's cracking. Now, this happens to be a lower tooth in my example. Yours is an upper, but it's the same mechanism. And you'll see the crack is proceeding through the layers of the tooth. Now, I think your crack in your tooth is about here, as you see now. Here's the thing, Joe. I've seen people that ignore that kind of problem, and it gets worse. You see, dental problems don't heal on their own like much of our body. You crack a bone, it's going to heal. You crack a tooth, it can't. So if it gets worse and worse and it gets to the point shown here, we can't fix it at all. That's when people wind up having a tooth out. Now the good news is yours is back right here. So Joe, let me go quickly into another screen here. Okay, Joe, this is what we need to do. After I remove all the cracked and problematic areas of the tooth, it'll look a lot like this. I'll need to go in and build up any areas where we're shy, where we don't have enough foundation. And then I'll put a crown on top. A crown is a cover that fits right over the top that has the same shape and size as your original tooth, same color, and you could chew on it like a natural tooth. In fact, once I glue that crown in, you can go ahead and use it just like you used the tooth before. It'll be stronger than the tooth was with the crack. Joe, any questions about what I've shown you today? Now, if you rewind back the video, you'll find that that narrative is very fast. And I explained a difficult concept much more easily than I can do with an x-ray, where cracks are very difficult to perceive. They have to be exactly in line with the beam, and even then we can't see them. Or even an intraoral photo, where we're saying, well, you sort of see it here, because in my illustration, it's obvious. So, that was 2 examples of how we use DDS GP in our daily conversations, along with some narrative suggestions for you. Now, you might say, look, I have my own way of saying things. Well, that's just fine. You be you. But I want to tell you, by using these me and you together versus the problem narratives, it brought my case acceptance up, way up. And it took my practice to the next level. This is your chance to do the same with yours. And by the way, one more thing before we sign off today. You notice that I keep saying, I say, I say. Yes, doctors, the treatment plans that are the most important for you to do are the small ones. Sit down with every patient. Here's what I hear from doctors. Well, I don't have time for that. I'm too busy. Well, if you're too busy and your production isn't where you want it, then we got to look at some other problems in the office, like, are you running around? Are we doing all small cases? Because if your case acceptance on the big stuff, the multiple crowns, the rehabs is low, you'll end up doing all the basic stuff that's well covered by insurance or that's easy for patients to say yes to, like fillings. And that'll totally annihilate your day for bigger cases that bring in more production. Give that some thought and see if perhaps your narratives need to exist at all, and if they do, need some change. You certainly can delegate these narratives to your treatment coordinator, hygienist, front desk person. That's great. But then this person should watch this video and get good at it first. I hope it helps. We'll see you next time.